Okay, everyone, let's talk about wound care. So, wound care happens after we already have an injury. We have a lot of things that we put into place in order to make sure that you don't get an injury, but once you have an injury, we need to know how to deal with that as well. So, the main kind of injuries that we're going to have in class is we're going to have cuts. Most of them are going to be very minor, but we want to make sure that we understand a major cut as well. And then we're going to have burns, and we have first degree, second degree, and third degree burns that we're generally concerned with. So let's start off with cuts. The very first one is if you cut yourself, and I'm talking at all, you have a couple things you need to do. So the very first one is you need to make sure that you wear a Band-Aid. You put a Band-Aid on it, and we do that because the environment that we work in has a lot of debris. We're connected to a wood shop. We use a lot of chemicals. So we want to make sure that nothing is getting into your wound. We also want to make sure anything coming out of your wound is not getting on other things. So we don't actually want to have to deal with your blood. So you want to put a Band-Aid on no matter how bad the cut is. You're always going to have a Band-Aid. Now, I do have certain students that really hate Band-Aids, so I do have duct tape here for you. There is a first aid kit against the wall near the sink that has actually mustache duct tape if you want to use that, or you can go over to drawer number 6 across the room and there's duct tape in there as well. But no matter what, you are going to cover your wounds. And then clean up any mess that you have made, clean it off the equipment, clean it off the tables and things like that. Again, most of our wounds are really small cuts. You'll be able to quickly wash your hand to get off any germs and then put a Band-Aid on it and you're going to be fine. And I do have this entire great big jar of Band-Aids for you. And we will go through this entire jar probably twice in a semester, just so you're aware. But you would just grab a Band-Aid from right there. Now, if your wound is a little bit deeper or is bleeding a little bit more, it turns out glass cuts, they tend to bleed a little bit more. And if that's the case, you are going to make sure that you put pressure on it. And that pressure, you want to go for about 3 minutes, and then you are going to check it. So when you check it, you're going to look to see if it's still bleeding. If it's continuing bleeding, you want to hold it for another 2 minutes. And in that meantime, you might want to alert me so that I can come over and make sure that I look at it as well. And then I will tell you to go wash off your wound, especially after you put pressure on it. Put a little bit of water on it, maybe a little bit of pressure with a paper towel, and then you can put the Band-Aid on it. Those ones I ask you to take a couple Band-Aids with you because it turns out that cuts that are straight edge cuts like from glass or jeweler's saw, those ones heal really fast as long as you keep them dry. And so every time you get the Band-Aid wet, you want to replace the Band-Aid, and then they will heal really quickly. Now, we have another type of wound, and that would be a deeper wound where after that initial 3 minutes of pressure, it still isn't subsiding. And at that point, I definitely will want to see it just so I can evaluate the wound. And then I may be sending you up to the nurse's office. I will generally send you with somebody because I don't want you in the hall by yourself. It turns out that we don't always get to choose the way our body responds to a trauma. It could be the smallest of traumas, and sometimes our body will react as if it is a humongous trauma. And so generally I just send somebody up with you, take you up to the nurse's office, they take a look at it, put a Band-Aid on it, and send you back. However, every so often, you will need to actually go see a doctor. I had a girl years ago that ended up cutting her finger enough that she actually needed stitches. So it happens rarely, but it does happen. But the big one is you want to make sure that you are putting that pressure on it to stop the bleeding, and that you're washing it off and then you're covering that wound. As far as burns go, we have again, first degree, second degree, and third degree burns. Now, when you get a first degree burn, it means that you have not burned it very deep. However, it hurts. It just plain hurts. And so if you have burned yourself, you can put it under water and it'll help cool the baking skin that you have. And then if you want to, you can put a Band-Aid on it. But there's not a whole lot you can do with a first degree burn. It's just going to hurt until it heals. And then as far as a second degree burn, the way that you know you have a second degree burn is you are going to get a blister within that first 10 minutes. So if it is a blister within the first 10 minutes, you have a second degree burn, which means it has burned lower into the skin. Now, with a first degree burn, you can get a blister. It's just not going to be in the first 10 minutes. It means that your body is still trying to deal with it and process the wound, but it's just still not as deep as a second degree burn. So if you get a blister within that first 10 minutes, now you know you have a second degree burn. Again, there's not a whole lot we can do with a second degree burn. We can put it in the water, maybe a little bit longer to cool the skin from, what you've done to it. You can put a Band-Aid on it just so you don't keep hitting it against things. But for the most part, again, you just have to wait until it heals. Now with a third degree burn, they tend to act and respond differently. So with third degree burn, I always say you're gonna know what you did when you did it. And generally what that means is you have reached out and touched molten glass or something along those lines. And what happens to the skin is it is going to either become white and waxy, where it doesn't look like skin any longer, or it's gonna look charred, you can kind of think of meat. It's gonna have that charred look, or the skin is gonna completely slough off, which means it is movable. Now, with a third degree burn, we are not going to wrap a third degree burn. We are going to get you down to the nurse's office as quickly as possible. And there's that high likelihood they're going to send you to the doctor. Because with a third degree burn, the reason we don't wrap it or put it in the water is because we do not want the skin to come off with it when they're replacing the bandages. If the nurses choose to put a Band-Aid on it, that's fine, we let them, they are the experts. But in class, we leave it exposed to the air and we just get you down to the nurse's office as quickly as possible. That way, whatever the protocol for the hospital or for the nurses, they are gonna be able to do it without us having created a secondary injury for you by wrapping it and then having that skin come off. So you want to make sure that you understand that. Now, those are generally all we really have to deal with. However, if something were worse, let's say somebody had a major cut, we do have a tourniquet in class. We generally don't have to deal with it, but there is a tourniquet just in case. If you were to get something in your eye and we were needing to flush your eye, we also have eye wash. And those kind of sit behind the Band-Aids right here. Again, they're not used very often, and so we generally don't have to worry about it. However, there are a couple of things that you may also need to know for the classroom purposes besides just the injuries. And that would is if we have somebody that has either injured themselves bad enough or is having a medical emergency, we may need to get help here as quickly as possible. And so what we do with that is we are going to come over and we're going to use the phone. So the phone is one of our pieces of equipment, really. And so what we would do is I personally would go sit with the student that has the injury. I will say, call the office, and what you would do is you would come over here and you call this number right here, 6550. Now when you call 6550, it is going to dial into the office. And we dial the office and not the nurse's office because when we dial the office, they have phones and they can get people with walkie-talkies down here faster than trying to get somebody from the nurse's office to answer the phone. So we call the office and then we try and give them as much information as possible. If you know the student's name that is injured or down, you would simply give them that name and then you would tell them which classroom. If you don't remember which classroom, it is right here. Miss Riley's right there, so they're all highlighted. Or you can just simply say the glass or the jewelry room. They will come directly to us and they will be able to get to us quickly. And so we would want to do that. Now, if that was the case, what we would do is, again, I would be sitting with the student that was injured. Somebody would be calling the office for us. And then what would happen is the rest of the classroom, if I did not need them any longer, would get up all together and then they would walk out our front door. When they walk out our front door, they're gonna go put themselves on the brick wall in front of my classroom. And when you guys are out there, you wanna make sure that you're incredibly quiet. And the reason for that is I'm dealing with somebody that is having a medical emergency. And I do not want to have to think about you outside the classroom or what it is that you're doing. If it was you that was on the ground, you would want to make sure that nobody was messing around so that I could have full focus on you. And so that is what we want for the other students as well. As soon as the nurse and everybody comes down and the person is being taken care of, what will happen is I will then go outside and I will give you any information I can on the situation. So if the person is waking up, I would tell you they're waking up, or if we got the bleeding to stop, I would let you know that kind of thing, in order to make sure that you are okay as well, because you have now witnessed a trauma as well. And so we just want to make sure that we are, giving people privacy while they're going through something that is stressful. Now, if the emergency was greater than what you believe we can handle in the school, and there's kind of obvious things that we can handle, like a cut, we're going to be able to handle. If it's a really bad cut, we're probably still going to be able to handle it, or we have time to kind of figure that out. But if it's a bad enough cut, and I hate to even say it, but let's say somebody, ran their hand through the miter saw ran the blade through their hand. Obviously, we're not going to be able to deal with that trauma within the classroom, or honestly within the school. So what we want to do is we want to immediately call 911. We want 911 or the ambulance and everybody to be on their way while we're alerting other people to the fact that there's an emergency in our classroom. Now, if you feel that 911 is the right call to make, I want you to make it. I will back you up. If you are looking at somebody's wound and it is so horrific that you're like, we need extra assistance, the school is not going to be able to deal with this, you can walk over to my phone here and you can actually call 911. You don't even need to dial 9 to get out. You can call 911. And then we want to make sure that they are on their way to the right location. So here is the school's address. However, everybody knows where Battleground High School is. So if you just say the front of the school across from Burgerville, they will get here. We will send somebody outside to wave them into our classroom if that is the case and that we were needing emergency services. We also would want to go over on the, right above my computer, right next to my computer, there is a secondary button that if we push it, the office answers. The only reason we don't use that generally for standard emergencies is because when they're answering, everybody in the office can hear what's going on. And if it was you that was injured, you may not want your name blasted out across the entire office. However, in some situations, we cannot avoid it. If the phone is not working properly, we would use that secondary button. If somebody is on the phone with 911, we would use that secondary button. Now, you can also use your cell phone in order to call 911. We just want to make sure that somebody is on the way in order to assist if there is an emergency beyond our ability. So those are the general guidelines of the classroom and trying to make sure that we are safe. So I hope you do your part to make sure that we get to keep our classroom safe.